The use of these AR pathway inhibitors and the classes of drug that block hormonal signals in prostate cancer in conjunction with testosterone lowering have been tested in phase 3 trials in patients with metastatic hormone-sensitive prostate cancer and have all shown a survival benefit compared to androgen deprivation or testosterone suppression alone. But in all of those trials, those drugs were continued continuously. So abiraterone, enzalutamide, apalutamide, darolutamide were all given continuously until progression. But what we know is that in many of these patients, the PSAs go to 0, and the scans often don't show any evidence of active cancer. So once a patient is in that kind of state, the question is, do you actually need to continue on these drugs ongoing and forever to maintain optimal benefit? Is there an opportunity for some breaks from treatment to recover testosterone or just to save yourself from some of the side effects that you might be experiencing? And are there any downsides to doing so? So obviously the testosterone lowering has side effects, and so the side effects are both short-term kind of side effects and long-term side effects as well. And so the short-term side effects are the things that people know, the hot flashes, the fatigue, the weakness. But there are also some concerns about long-term side effects in terms of metabolic changes, weight gain, muscle loss, bone loss, risks to the heart, risks to the brain, concern about risks of dementia, things like that, with long-term androgen deprivation. And so if you are on this kind of regimen where your PSA goes down to 0, are the harms of the ongoing treatment actually worse than the potential benefits of staying on? And so this is really just a pilot study to take a group of 75 or so patients, have them stop treatment, and then follow for how long it takes before they need to resume. And the presumption is that if a good proportion of men are able to remain off treatment for a substantial amount of time, and what we're calling that is 18 months, then that would justify the idea that giving people treatment breaks might be of benefit.